Welcome, ladies and gentlemen, to sqadia.com. My name is Muhammad Usama, and today we are going to talk about cellular reactions to injury. And this section of this series of lecture is about adaptation to environmental stresses as well as chemical cell injuries, etc. So we are going to talk about what are the contents. So free radical injury, chemical cell injury, and adaptation to environmental stresses. So these are the components that we're going to talk about in this lecture specifically. So let's start off with the free radical injury. So what does free radical tells us? So free radical is something which is free to move around, free to do whatever it wants. So it is not bound to anything. So that gives us something or some information regarding its behavior. So it means it's reactive. It can react with anyone because it's free. So molecules with unpaired electron in outer shell, for example, superoxide ion and hydroxide ion, they are actually free radicals and they can cause cell injury. You can see the example here. This is a picture, very good example. So you can see this is a healthy, stable atom, and this is a free radical, which is a damaged atom. So this free radical can actually take electron from the other atom, which is a healthy stable atom, and then actually that stable atom would also convert into a free radical. This can also occur with molecules, not only atoms. So that is what actually applies here. So these reactive entities would actually damage the different structure of the cell because everything is composed of molecules and atoms. So how do these free radicals come into being? So there are different reasons for them to form. Sometimes they are even formed as a byproduct or as a product of the normal metabolism. So that is also normal, but our body has a protective mechanism to take care of them or deal with them. So it is normal as well. So they can be a product of the normal metabolism as well, but they need to be counteracted as soon as possible. Then we have the oxygen toxicity, in which there is actually alveolar damage, which results in respiratory distress syndrome, which can result in different type of free radicals such as superoxide and hydrogen peroxide. Then there is the ionizing radiation, which is a very popular phenomena, which can result in free radicals like exposure to alpha rays, beta rays, gamma rays, X-rays. For example, we go to different hospitals and patients come to us and we refer them for radiographic imaging. So they are also exposed to these ionizing radiations, and that can also result in the formation of free radicals, which can also cause free radical cell injury. Other than that, ultraviolet light and actually the ozone around the earth protects us from ultraviolet light, as well as our skin has melanin, which also protects us from ultraviolet light. So if we are not protected from the ultraviolet light, that can also result in the formation of free radicals. Then we have different types of drugs and chemicals, because drugs and chemicals, when they enter our body, they also take part in chemical reactions, and they can result in the production of free radicals, which are very harmful. And then reperfusion after ischemic injury and other conditions include, like, for example, air pollution and tobacco smoking. They can result in different types of free radicals when we inhale them. Ionizing radiation, as I already told you, UV light, as we already discussed, normal metabolism, as we already discussed, and inflammation as well. So these are the different conditions or different processes which can result in the formation of free radicals, which are actually a harmful entity and cause cell damage. So how does our body actually respond to them, and what should be the normal response? They should be degraded as soon as possible, but how does that occur? So that occurs via intracellular enzymes or the exogenous and endogenous antioxidants. So intracellular enzymes such as glutathione peroxidase, superoxide dismutase, and catalase, these are enzymes which are actually present in our own cells, in our own body, and they actually help us from these free radicals. On the other hand, we have exogenous and endogenous antioxidants such as vitamin A, vitamin C, and vitamin E. That is why vitamins are a very important part of our diet, and they should be taken in our daily or regular diet, and because they have a very important role in the degradation of free radicals. And then we have cysteine, glutathione, selenium, and transferrin. So all of these actually behave as antioxidants. So here you can see that this is a free radical. Okay, now this free radical is trying to steal an electron from a healthy atom. But what would happen is that this free radical takes this electron, and this healthy atom or this healthy molecule would result in a free radical. So that would actually not benefit us. But what antioxidants do, they have an extra electron, they have an electron which they have the capacity to donate. So they give their electron to the free radical to stabilize it so that it would not react with other healthy atoms or molecules and result in free radical cell injury. And another very important thing that is that these free radicals can also degrade spontaneously. Now, another important thing is the chemical cell injury. Different type of chemicals can also cause cell injury, similar to hypoxia and free radicals. Here we are going to take an example of liver, in which liver membrane damage occurs by the production of carbon tetrachloride, not essentially carbon tetrachloride, but what happens is that it is produced by P450 system in the smooth endoplasmic reticulum in the liver cells, which produce actually carbon trichloride, and this carbon trichloride is actually a negative radical, so it has the tendency to behave as a free radical and cause cell injury. So what happens is that when this carbon trichloride reacts with the liver membrane, it diffuses throughout the cell, and a lipid peroxidation, because oxidation of the lipid in the membranes occurs of the cell as well as the intracellular organelles, and this leads to disaggregation of ribosomes, similar to as we discussed in the hypoxic cell injury. So disaggregation of ribosomes results in decreased protein synthesis, because protein synthesis is carried out by the ribosomes in the first place. And then again, plasma cell membrane damage, similar to what we studied in hypoxic cell injury, which results in cellular swelling, calcium influx. That calcium influx then causes mitochondrial damage and calcification in the mitochondria, and protein denaturation, and eventually cell death. So all of this process is actually similar to that in the hypoxic cell injury. Now, adaptation to environmental stresses. Our body is very dynamic. It responds to the stimuli from the outside, and our cells, in terms of their structure, in terms of their number, in terms of their functioning, also respond to different types of stimuli from the environment. And that environmental stimuli can also be in the form of stress. So one of the stimuli is, for example, let's take the example of hypertrophy. What is hypertrophy? Hypertrophy is actually the increase in the size of the cells. Let's take the example of a muscle cell. For example, we are talking about bicep. If someone is training his biceps via a dumbbell or weight, so a greater amount of force needs to be exerted by the biceps to carry out that load. So that is actually a stress, that is actually a stimuli. So what those cells do in response to that stimuli, they increase their size so that they can generate greater force. So that is actually an example of hypertrophy. So hypertrophy does not mean that there is actually a greater number of cells. It means that their size of those cells which are already present increases, so their functional capacity increases as well. On the other hand, hyperplasia, it may sound similar to the hypertrophy, but it is essentially very different, because in cell hypertrophy, the number of cells remain the same, even though the tissue may increase in size. Whereas in cell hyperplasia, the tissue may increase in size, but the number of cells is also increasing. The example of this would be the glandular proliferation of breast during pregnancy, in order to be able to lactate the child which is on its way. And then there's the atrophy. Atrophy is actually the opposite of the hypertrophy, and it is actually the same number of cells are there, but they diminish or shrink in size. Let's take the example of the biceps muscle again. So if we stop using it, so that it goes into disuse atrophy. All right, and then there's another term which is hypoplasia. Hypoplasia is again the opposite of hyperplasia. So if there isn't enough stimulus, and if there is actually a decrease in the number of the cells and not just their size, then that is hypoplasia. Aplasia, as the name shows, aplasia, so it means absence of something. So in the embryological stage, or during the growth of the embryo, if there's aplasia, so that may result in agenesis of an organ or a structure, like there would be individuals which would not have a proper limb, or the absence of limb. So that is actually an example of agenesis. Or it can also occur after birth, in which there is loss of precursor cells in proliferative tissues. Let's take the example of bone marrow, so in which there is absence of proliferative tissue, and then the bone marrow, like for example hematopoietic function of the bone marrow would not be able to occur because of the aplasia, or the diminished ability to divide. And then there is metaplasia. Metaplasia is actually the number of cells not essentially increases, the size of cells not essentially increases, but actually the type of cells actually changes in response to a stimuli. So that is metaplasia. There are actually three different types of metaplasias. There's the squamous metaplasia, osseous metaplasia, and myeloid metaplasia. So let's start off with the squamous metaplasia. In squamous metaplasia, there is the replacement of the columnar epithelium by squamous epithelium at the squamo-columnar junction in the cervix. So what is columnar epithelium? You can see this figure here. The cells are actually arranged in a columnar fashion longitudinally. So this is actually columnar epithelium, and this here is actually the squamous epithelium, in which the cells are arranged in a flattened state. So they are arranged in a very, these cells are very flat, and they are not columnar or longitudinally arranged. So this is the example of metaplasia, and it is known as squamous metaplasia. So this type of tissue is substituted or replaced by this type of tissue. So there is not actually a change in the size. So it is not atrophy or hypertrophy. There is not change in the number of the cells. So it is not hyperplasia or aplasia. It is just the change in the type of the cell. So this is squamous metaplasia, and it is often reversible, so it can be reversed as well. And it is also sometimes associated with chronic irritation, such as in the bronchi with long-term tobacco use, and which may result in shift from columnar to squamous epithelium, and also in conditions such as vitamin A deficiency. Now there is the osseous metaplasia. So like for example, there's a soft tissue here, and then there is actually a formation of new bone at the site of injury, and that site of injury did not have a bone before that, but now it is replaced by a bony tissue. So this is actually osseous metaplasia. Okay, and sometimes cartilaginous metaplasia may also occur, in which there would be cartilage in the site where there wasn't cartilage before. So this is osseous metaplasia. And then there is myeloid metaplasia. So what happens is that hematopoiesis actually occurs in the bone marrow inside the long bone. So if it starts to occur outside of that in other parts of the body and other tissues of the body, then that is actually known as extramedullary hematopoiesis, and that is actually an example of myeloid metaplasia. So proliferation of hematopoietic tissue in sites other than bone marrow, such as liver and spleen, instead of the bone marrow. So that was all about the free radical and chemical cell injury and adaptation to environmental stresses. So we talked about free radical injury, chemical cell injury, and adaptation to environmental stresses. Next time we're going to talk about the apoptosis. So please keep on watching sqadia.com. This is Mohammad Osama signing off.